You're allowed.
And on TuneIn.com, Hang.fm, and UpSnap Mobile.
Contact Talk Radio.
Welcome to the Bad Girl's Guide to Living Well with Heather Dowen, NMD. Spend time with Dr. Heather and her guests for tales of love, adventure, and how to be healthy and happy. Now, here's your host, Dr. Heather Dowen.
Hello, everyone, and welcome to the Bad Girl's Guide to Living Well. Today, I have Dr. Greg Eckel on, and his purpose is to help as many people as he can achieve optimal wellness using integrative care. We are a podcast associated with naturopathicmd.com, where you can learn more about functional medicine and get tests and supplementation, etc. So we do a lot of virtual long distance care, but Dr. Eckel is one of the people that you definitely want to have in your back pocket for certain things if you need on-site care. And he is an expert in neurological diseases, and we're going to be talking a lot about that today. So he utilizes a blend of Eastern and Western medicine to find the right balance, and he meets you where you are to get optimum results, which is one of my favorite parts, because if you don't meet people where they are, you can tell them all day long that they need to do certain things, and if they don't do it, then that's worthless, right? So this is a story about love, and we don't have a whole lot about love on very often, but Dr. Eckel's life path has led him to become an expert in chronic neurodegenerative diseases, including Parkinson's, multiple sclerosis, dementias, and Alzheimer's. With the recent passing of his wife, Soraya, from Creutzfeldt-Jakob disease, which is a prion disease and is currently an incurable disease, he knows firsthand the travails of caring for and living with chronic neurodegenerative disease. During that process, he uncovered insights, patterns, and therapies that many can benefit from, and it is his passion to do so. So Dr. Eckel is a heart-centered physician, always striving for the cutting edge of the therapeutics and results. He's sought after for lecturing and educating other clinicians and the public. So we're very lucky to have him today. And thank you for joining us, Dr. Greg Eckel.
Thank you for having me on.
That's a good introduction, right?
That was amazing.
I'm very, very happy to have you. So thank you for making time for us today, because this is a huge piece of hope for medicine, I guess, and hope for people. Can you tell me a little bit, before we get into the nuts and bolts of it, we want to know a little bit more about you as far as, like, how did you get into naturopathic medicine?
You know, I was a preschool teacher in Portland, Oregon. I was in a Montessori Earth school teaching 3 to 6-year-olds. And, in the early 90s, it was it was kind of the beginning of the diagnosis of attention deficit disorder. And I watched all of these children being put on Ritalin at that point. And I just thought, gosh, there has got to be a better way to help these kids. And I have my poster child his name was Michael. And I like to say Michael included many others in his learning. He was the wild guy, he was up and around. And if you've ever been in a Montessori classroom, the kids are encouraged to get up, pick their work, they're self-directed, and Michael would flit around, and the head teacher, it was a little disruptive to the other kids. And so the head teacher advocated to the parents, like, hey, you should take him in, maybe get him, check this diagnosis out. Lo and behold, he got diagnosed with attention deficit disorder, came in on Ritalin, and just sucked the life out of him. I mean, he was slumped over in his chair. He stayed in his chair, but that little shining light was gone. And that just led me to, basically go to the college. So in Portland, Oregon, we've got the oldest and best naturopathic school. I'll put that out there. All of the other colleges were formed by graduates of NCNM, or now Newton. So just a little jab for the doc there. But I was a junk food vegetarian, and my friends, in my early 20s, and all of these paths led me to the naturopathic school. And I thought, wow, I can really get behind a medicine that all they did was really address my diet. And I felt a ton better. And I always knew if I went back to school, I wanted to be in service to people. And it just, so many paths led me to naturopathic school. But, I really carried Michael as my, kind of my motivation during those hard years of academia.
Yeah. Do you still treat that? today?
I do, a lot less so, as over the last 18 years of clinical practice, it takes you in a lot of different routes. Children are still near and dear to my heart. I have 5, and
I can see your halo.
yeah, that's it. Yeah. And but so I actually do. I saw a child 2 weeks ago with attention deficit disorder, perceived. There's a lot of different routes that we help those kids, but it's not the main focus of my practice these days.
I see. So let's talk about what the main focus of your practice is. And it's largely more chronic neurodegenerative diseases, correct?
Yeah, we kind of evolved into that, as you said in your intro. I recently, really recent, have lost my wife, and it was after about a 18-month stint of going through this process. And I've always been fascinated by neurology. I wrote my doctoral thesis on actually allergies and asthma and the immune system, but that actually came full circle in this last 18-month period of looking how immune system affects brain function and different ways to get at healing the brain. So it really, I've been doing a ton of naturopathic, in Oregon, we're primary care and have a really great broad scope of practice, have a destination clinic at Nature Cures Clinic. It's right downtown Portland. So, we get a bit of medical tourism going on because we have such a great restaurant scene and food, and, it's a really great city to be in. And we're right downtown. But the neurology component has always been a kind of a mainstay of my practice. Used to do a lot of neurofeedback. I got into neurofeedback actually with treating the children with attentional issues and, really providing that feedback to the brain. I had to spin that out though. It was too many beeps and buzzers and computer screens, but it's a still great technique. But so I've been doing brain research and studying the brain neurology, the mind, and just even kind of metaphysically, it all kind of ties together here.
I love it. I can't wait.
Yeah. So we, so I put it all, just this last 18 months really has really split me wide open as a practitioner, as a person on the planet, losing, I might get a little choked up here.
Sorry.
No, that's all right. It's, the component of grief and grieving, we don't really do that well as a culture either. So when you introduce it as a great love story, it really is. I had found the love of my life, and we blended our families together, and, she kind of checked out a little too early. But amazing being, my wife, Soraya, she was also a practitioner. She was a certified nurse midwife, nurse practitioner, really radical feminist female healthcare provider. So we did that kind of dual East meets West. I was the more conservative looking, but she was the one with the dreadlocks on her head. So, she provided the conventional medicine, and I did more the naturopathic and Chinese medicine. Yeah. So the neurology component really, it has fascinated me from the beginning, just even in school. And it's, multifactorial. When I really think about it, I look at it at a genetic level, a physical level, emotional level, and almost spiritual level. I don't really like to, the spiritual, once you say that word, it kind of turns off a good portion of the population. I said it here, so hopefully you don't glaze over or check out. But there's a piece out there, right, that we can bring in, and whatever that word means for you is the way that I approach that with folks.
Well, I think that there's plenty of research out there, even if you get to the point where you're talking about repetition and visualization in sports, right?
Yeah.
The brain cannot determine the difference between what you are seeing from your eyes and what you are visualizing. And there's tremendous power in that. And we're seeing, I have trouble, and I know spiritual holds a lot of, connotations for some of us that, steam when we walk into churches and such. Sure. But I think that piece of mystery that animates us cannot be underemphasized in wellness.
Yeah, that's a great way of putting it. And, as we get more into quantum computing and mathematics and just quantum physics, it's an interesting, it looks like they're coming back together here. So
they have to.
Yeah. And the mystery, that's the way I've talked about it for the last 18 years in practice with patients too, is, it's amazing how much information we know about the biochemistry and physiology of the body. But really, I mean, we don't really understand what the hell's going on.
No, we really don't.
Yeah, we can go in depth and geek out on that. And I love doing all of that. Don't get me wrong. But then that mystery component is, it really needs to come back into the dialogue and really treating, I guess one thing, just to bring into the discussion is, I don't treat pieces or parts of people. I treat whole, centered, dynamic beings moving through time and space. And so that's the beauty of the way that we practice is we actually see and listen to people. And you can be the expert on the biochemistry or the physiology or the pharmacology of the different processes, but really we are greater than the sum of our parts. And really to understand that and treat people that way, number one, it's refreshing. Two, it's a lot of fun. And the results that you get really looking at the whole being and and understanding that it's all a symphony together, that's the part that really makes our medicine fly.
And I think that was one of the best descriptions of what true holistic medicine is that I've ever heard.
Well, thank you. Yeah.
Right? I mean, because
I've been working on that. Yeah.
It's pretty good. It's pretty good.
Yeah.
So I think it's a beautiful thing to look at how there's always a niche that we're supposed to occupy, right? Like you're currently looking more into neurology. Like I'm currently doing more with, sports medicine. However, like you said earlier, allergies and asthma, both of those things affect what we do day to day. So with our fundamentals, as far as like how we treat people and what we support in them, it affects every system of the body.
Yeah. For sure. I mean, it's those basics, kind of the naturopathic principles and the basics of physiology in life. I was actually just watching a longevity discussion, and the basics are you have to eat well, you have to rest and sleep well, and move your body. I mean, it's not sexy, And
there's no pill that'll do any of those things for you.
Well, I actually have this purple pill now. No, just kidding. Just kidding. So, one of the things that I found in the Parkinson's and neurology, so I really have narrowed, kind of scoped down a bit. So, to when we talk about niching down and looking at specific processes, and I'm actually in the process of writing a book on Parkinson's. So that's coming out hopefully in this next 6-month period.
Oh,
great. I've just found, so many folks, there's nothing that really, in these chronic neurodegenerations, there's no solution, right? So in particular, Soraya had this really rare 1 in 1,300,000 cases in North America disease process off of prions, these misfolded proteins, right? Kind of archaic structures. You'll hear more about them now that we've said them, and we're going to talk about them a little bit here. You'll see them. They're implicated in anxiety, Parkinson's, dementia, Alzheimer's. And there's not a great test in the United States. Now I'm looking to bring in, so first evaluation is kind of the starting spot for any of these conditions. And there's a nasal swab that they use in Italy, the Netherlands, and Japan. 95% accurate and specific. You can swab right near the cribriform process up in the nasal passageway for prions. And these were just discovered in 1997. Staniel Prusiner down at UCSF, who I've been in conversation with, him and Del Bredesen, they actually were in the same lab. So Bredesen does a lot with Alzheimer's research, has the Bredesen protocol, basically doing naturopathic principles with people through diet and bringing back their health.
No, I loved it. He wrote the End of Alzheimer's. And when I read it, I felt like a little bit in love with him, just because he was able to take what we do and put it on a stage and then actually reverse the signs of dementia in 6 Alzheimer's patients out of UCLA, which is huge. And he's doing naturopathic principles. So I love it.
Yeah, me too. You're right. That integrative approach, which is really meeting people where they're at and bringing it all together. So it's awesome. And he actually sent me a paper on the prions are implicated in, all of these conditions. And we're not even looking for them in this country, right? Right now, the current diagnosis is you've got to do an cerebral spinal fluid. So you got to do a spinal tap. People are not electively going in for a spinal tap. It's a super painful, invasive procedure. No fun. And it's not even definitive at that point.
Right.
So, we need to look for these things, but that's a piece. So I'm looking actually bringing that into this country, and it's not FDA approved, but just to kind of fast track it, because it would be nice to have that clinically for clinicians in their offices, just to screen to know. Now, unfortunately, if it comes back positive, I think that's the issue, is there aren't a lot of therapies, right?
Right.
So I actually found 2 substances that help with this, and I'll talk about those later. So I'll just prime the pump there.
Okay, good.
So on other things that I look at that in chronic neurodegeneration, and specifically for Parkinson's, heavy metal burden. So we had there was a YouTube video put out for Parkinson's patients on a glutathione push. David Perlmutter, functional neurologist out of Florida. I don't think he's practicing anymore, but maybe 15 years ago, did a glutathione push, put it on YouTube, and it showed a gentleman with kind of the stutter step gait of Parkinsonism, and did the push, and he had nice fluid long walking, right? And then Dr. Perlmutter was saying, it wore off. And so I saw that, I started doing it immediately in my clinic, and it didn't work for anybody. It was like, what is this?
Yeah, I kept taking the dose higher and higher, and then I was like, this isn't even, I couldn't reproduce it either.
Yeah. And I thought, did he have a hired, patient or something? Like, what was that? But I started testing for heavy metals on those folks and found, actually, well, lo and behold, in a naturopathic clinic called Nature Cures, I'm seeing the tough of the tough cases. So they've already been through kind of the medical mill.
Right.
And what was not looked at was their metal burden. And we know we store metals in our fat. We could call each other fatheads, right? Around all of our nerves, we've got all of that fat.
Right.
So looking at it, cadmium, arsenic, lead, mercury were the top 4 that I saw coming out of these folks. So you got to, any neurological condition, you got to start with that, is the metal testing.
So just to be clear for people, because we do have clinicians that listen, but also obviously public. And so can you tell me what the best test that you run for heavy metals would be, and why?
Sure. Yeah. So there's an agreed upon in our naturopathic environmental medicine branches. We've come up with some protocols that we all agree to, and you do a pre and a post test. You do a pre-test, which is just collect your urine in the morning before you do anything. One, you want to rule out that you don't have any acute exposures to any of these metals in your drinking water. There's a potter out back that's doing these leaded glazes, and which still occurs.
A lot of fish.
Yeah, a lot of fish, right? Or even just a general little bit, right? Our planet, we know, we all have heavy metals in North America. I'll get back to that one. So really, and then you do an IV challenge test. I like the IV challenge test. I see a lot of folks that come to me with a hair analysis. It's a little easier, less invasive, but there is a genetic component. People are not excreting metals through their hair, and I just don't find it to correlate to anything.
Me neither.
So I like the metal test, the metal challenge test. And so people might be thinking, well, where did they get the metals, right? So I live here in the lovely Northwest. We get this plume of dust from China every year. They're doing coal-fired plants there, comes down in the rain. Here in the Northwest, Northeast is the acid rain from the Midwest coal-fired plants. It's in our fish. It's ubiquitous in our environment. So when I first learned about this metal burden and people, I was testing everybody, and lo and behold, it was coming back for everybody. And so I had to stop that, because it's a can of worms of, well, is it causing you your health problem? So I did draw the line, though, for neurological issues. It may be. So we need to really rule that out.
Right. I
Yeah.
usually do heavy metal testing kind of as I've peeled the other layers back. And if people
Yeah.
aren't getting like the results that they really are
That you're
looking for,
anticipating.
and it's like, because some people I think deal quite well with it, right?
Yeah.
I
Oh
mean,
yeah, genetically, their genetic picture is like you can deal with the level of toxicity. You've evolved, and good for you, right?
right. Well, in this way, right? Because
Right.
who knows what's other other
Other
derangements of
processes, right?
physiology. But I did a lot of, I studied with Dr. Bill Ray in
Oh, great.
Memorial
Yeah.
Center, Dallas, and he
Yeah.
was one of the guys that did some of the first heart transplants. And his son told me the story about how one of the kids had terrible allergies, and he got to thinking, if we have to control for all of the chemicals during surgery when we're doing this, how do we not control for all of the chemicals everywhere? I mean,
Yeah.
they're everywhere. We get them in California. I was talking to someone that worked for the EPA, and he's saying that when the trees burn,
Yeah.
it comes down in rain and then fills our aquifers up, and our water plants can't get it out.
Wow. Yeah, even more so, right?
Everywhere.
So, it can get really depressing quickly when you talk about this.
Yes.
But on the bigger piece of it, like you're saying, is like genetically, some of us can tolerate more.
Right.
And also, I think we don't really realize how powerful we are as humans and what we're capable of.
Right.
And so there is that, coming from authority figures and or physicians saying like, we're damned, it can be like 10 times worse.
Yeah.
There is a reality of the discussion of like, yeah, we got to wake up. Like the planet, it's us. We're just toxing us. As an undergrad, I studied environmental studies, and I always thought, why are we talking about save the whales? It's really save the humans. Like if we don't wake up and do something about this, we're in some doo-doo.
Oh yeah, we're seeing it everywhere. I think that,
Yeah.
Whatever the toxic load is, not just heavy metals, I think heavy metals are especially problematic for the neurological system in the brain, obviously, because they love fat so much and they get
Right.
stuck in there. They can cross the blood-brain barrier without too much of a problem as well.
Right.
And so we reserve them and like save them in these places where we're most vulnerable.
Yeah. Yeah. And it's the body's inherent ability to heal itself. It's like, oh, let's get those out of circulation, put them in the fat, store it in the fat. So that, you look at the fat reservoir of the brain, there's a big one up there to just put stuff into. So that's one that I found in neurological conditions. If you've got a Parkinson's diagnosis or a loved one, that definitely needs to get ruled out. The other big one are chronic viral illnesses that are, the person doesn't feel sick, but they've got Epstein-Barr, herpes simplex, cytomegalovirus that are just circulating at low levels, enough of a component to just play havoc with our innate ability to heal and distract us, make us tired, etc.
Right. Which is also sort of like molds. I think I've seen a lot of stuff with mold neurologically too.
Yes.
And really, whatever it is that makes your body less able to handle whatever the stress is that's coming to it, that's where we start to see disease, I think.
Totally. Yeah. When your cup is full, it runneth over. That's where the symptoms come in. And at that point, it's a little bit like maybe a bit too late. Like we really want to prevent that from happening.
Oh, no kidding.
Yeah. So on the diagnostic front, those are the big ones. The third component that I find goes overlooked with this, in particular Parkinson's is called the hypothyroidism of the brain. And a good portion, I just spoke at a Parkinson's support group on Tuesday night, and did a show of hands. About 60% of them were on some type of thyroid medication. And so again, it's not for everybody, but it is something to be looked at for sure.
And that's the beauty of what we do, because we follow that path and put that puzzle together to figure out, like, if it's not metals for someone, I mean, obviously it is at some point, or like inflammatory, or, thyroid,
Right.
What is it? And so
Hormones, right.
Hormones. Yeah.
Yeah. Yeah. So those, in a true evaluation, kind of more of that holistic component, we're really trying to pinpoint what's right for this individual here in front of us. So that's more on, that what I just laid out there is more biochemical, biochemistry, physiologic treatments. And, that is a component of it. Now,
Now tell me about the really cool stuff.
Yes. So that's where we're going here in our discussion. So, a piece of it, because I've gone through, I like you're rolling up your sleeves. I like
No,
it.
I love it.
Yeah. We're, looking at one, prevention. It's like, how did this ever happen to my wife? How did this get activated? Where did it come from? But two, then, I start asking my patients the same questions around the path that I was on. I started going down through, okay, well, early childhood trauma. So I uncovered, it's called Germanic New Medicine, Dr. Hammer out of Europe, which is the pleomorphics or the biologics of kind of the combination homeopathics to detox the body. Dr. Hammer was expelled out of Germany, had to live in the Netherlands because of his thesis was on this trauma causes disease process. And, of course, in true scientific method, they threw him out of the country, for asking a question and proposing a thesis, a hypothesis in a true scientific method. They wouldn't even listen to his paper, so in our, faux religious dogma of science that we have now, that I think a lot of us in the naturopathic community are waking up to, like, wait a minute, the emperor wears no clothes here. Like, we can just we don't have to rail against that system. We just have to replace it. And that's what people are voting with their dollars and their choices on. You know what? We get it. Western medicine doesn't have the complete answer, and they don't have the answer, right? As far as I've seen.
I think that being rated 37th in the world for chronic care.
Super telling. Yeah, right. The proof is right there. Right. And we spend 10 times more. It's ridiculous. And
no one is ever expected to get better.
Yeah. That is an awesome point of, I always leave the door open for people to have a spontaneous remission, right? So I don't claim cure. I actually do a lot of nothing all day. It's somebody's body and the medicine. These things come together and work. And my job is to remove the obstacles to cure.
Right.
So many times I actually, in the first patient visit, I've got to erase that tape. I always ask people, like, have you been given a prognosis or a timeline of this disease process? Whether it be from depression of, like, I have a biochemical imbalance in my brain, the doctor told me. It's like, there's no way you're deficient in SSRIs. So we need to get rid of that thought belief pattern, because that is so damning to an individual coming from a professional.
Right. It's a self-fulfilling prophecy.
Yeah.
It's like hypnotizing someone with that piece.
Well, it's a nocebo, right? We've heard of the placebo, but the nocebo is a negative effect of a thought process or belief. So, and that's very powerful.
It's a little bit off topic, but because of what you just said with SSRIs, in your research that you've been doing, have you seen associations between, like, the gross number of antidepressants and psych meds that we're prescribing and neurological degeneration?
I actually have not come across that, because of my niche was in the regenerative medicine. What have you seen some stats on that?
I haven't seen stats on it. I read there was a book out a couple of years ago that I have had trouble finding a lot of the stuff since. But it was showing how, like, when you keep messing with the neurotransmitter balance and you have deregulation, or, like, you've got, less receptors, then we can set ourselves up. Because, I mean, if you have, like, dopamine altering meds in the brain, not SSRIs, obviously, but when you have that sort of psych.
Well, yeah. So Cinemat, and so actually, the main medications prescribed for Parkinson's are total symptomatic treatment, and they wear off. They lose their effectiveness, and I really think they complicate the picture so much for people. Cinemat, carbidopa, levodopa, really manipulating dopamine levels, and it is so end change symptomatic. We really need to go way upstream, and because that's the state of the art, right? That's like the penultimate Western approach is give these meds. I find it's hard. It's hard to get people off of them without complicating factors. And two, people come in after 6 or 7 years and they're not effective. They're at the major dose. Now they're taking other medications, and it's just really, it complicates matters, right? Again, I don't want to take choices away from patients. And if you're on them, by all means, stay on them until you get somebody to help get off of them safely. Or we can support you on them if that's your choice as well. Like, we really do meet you where you're at. But that is such the, more biochemical, physiologic end product treatment. Where we're going, though, is talking about this more energetic piece. So Dr. Hammer's work with this Germanic new medicine, they found from 0 to 18 months, 18 months to 3 years, and 3 years to puberty, any traumas in those areas of life led to different neurologic conditions later. And so it's pretty fascinating. I've got, even in utero. So then this goes 1, 2, or 3 steps deeper here. So into utero, so taking a full case and history for people is, okay, well, what was childbirth? What happened in the 9 months in utero, right? Were there any trauma? So that would be on the ectoderm, the mesoderm, and endoderm, and where as we developed and things unfolded, and what level is the pathology in. Fascinating stuff. Then one extra level is you get in on that and you see then this intergenerational, like our great grandmothers. So, that curse of 7 generations, it dawned on me in this last 18 months is like, oh, this is actually where it comes from. Our great grandmothers, any traumas or issues that happened there activated our turned on the genes that then are expressing today. So it has made my job as clinician so much harder and way more complex and fascinating as well. So many of us don't know our family lineage and don't know 3 generations back, maybe 1, maybe 2 if we're lucky. The advent of the genetic testing. So we bring that in here. To look at, it's not, your genes aren't your destiny, but it is the operating system that we're working with. They may or may not be on, but if you have some SNPs or deficiencies of pathways, we want to know that, because then we can tailor the therapies that we put in for you. So we can really individualize that plan and program. I use, and I'm not sure if you do, but the Opus 23 is one of the best programs that I use for that. You take the raw data from 23andMe and Ancestry, and it's Peter Diadamo of the blood type fame. His Opus is this major program where he's got the 3 major institutions. They're always uploading their new research into it, and it really brings the raw data alive. So, what used to be like a $10,000 test, now, you get the raw data and upload it in there, and it really comes alive.
I haven't used that. I'll
Yeah.
have to look into that. That looks really good. I haven't done a whole lot of training in genomics. The one that I've been doing is called Nutrition Genome.
Okay.
And it kind of breaks it down and it makes it really beautiful as far as what you can eat and what nutrients specifically you can use to strengthen the SNPs that they do find. So I find that like the patients have a good, like almost a map. And it's not as extensive, it doesn't sound like, but I think it's a good place for a lot of people just to start.
It's great. Yeah. I mean, you can get overwhelmed in that whole thing. And that's a little bit of the problem with it is because you don't know if it's an issue or not. You just know you have the deficiencies in those pathways. And so they may or may not be playing. And, it's like I start really meta with people. And then the other nice thing about it is then you can go over and go back into the program, and they've uploaded it with the new research.
That's
so
fantastic.
It's
That's very cool.
Yeah.
Very cool. So you do all of this physiological, strengthening of the system with nutrition and other, taking away the obstacles to cure. Right. So then you also do a really phenomenal therapy as well using stem cells that I would love to hear about.
Yes. So the regenerative medicines. So one of the things, again, so I'm looking for, there's no known cure for Creutzfeldt-Jakob disease. And I got in onto regenerative medicine and stem cells, and they are phenomenal. And you look at the amount of research, and I just realized, like, wait a minute, this is way too amazing to not start educating people about, because there is tons of research. So that's the biggest thing. I actually, was going on television on Tuesday as well, and a nurse practitioner sitting next to me said, well, there's not enough data on that. And I just looked at her and I said, do you not read journals? Like, what are you telling?
I love your style.
There's like tidal waves of research. In Europe, they've been studying it. We got cut off in the United States in '91 for religious reasons, which were absurd and really put us way behind the world in researching what I call miraculous healing units. The stem cells, they come in. So what are stem cells? These come from umbilical and amniotic fluid. They're ethically harvested from moms that had C-sections. They donate the tissue that used to be medical waste. We just used to throw this out. Like, oh, that's done its job. We're done with it. Well, lo and behold, there are these very potent messengers in there that help our bodies heal. Go figure, we're growing a baby, right? So it's phenomenal. These stem cell banks are well regulated by the FDA in this country. This is not an FDA approved treatment as of yet. People had to go down to Panama, go over to Germany, go over to Thailand. But now we can use the mesenchymal stem cells, MSCs. We just call them stem cells for short. And they will differentiate and help your body regrow cartilage, neurons for your brain, epithelial lining for your gut, bones. They are phenomenal. And they only know this. So when I first started studying it, I thought that the cell became us, which is a little bit weird, but that's not what happens. So that's not what happens. What these do, they come in, and I call them like the conductor of our own innate healing symphony. And they help coordinate. They'll donate pieces and parts. They'll donate mitochondria. They secrete, how they work is they secrete an exosome, these healing properties of our own body to use to repair. There's actually a concept of longevity is when you have no more stem cells, you die, right? And they decrease throughout time. So, average 35-year-old, one stem cell in 30 days will make about 32,000 cells. A 65-year-old, one stem cell will make about 200 stem cells in 30 days. So you can see as we age, they just go right down. I really like using the new ones, right? So we get them from the stem cell banks, and they're about 1 milliliter. You get about 1.5 to 2 million cells in there, and we inject that. I actually had the procedure done for me. I did an intranasal procedure, and I think that's how we got talking the other day around longevity, for hearing and eye loss, and it's got a systemic anti-inflammatory benefit. I was using it, really came out of the International Neonatal Stem Cell Conference, which talk about a niche. That's a niche. They're studying it in Italy and Spain for the use of neonatal stroke rehab. So babies in utero having strokes in the past have been just chronically debilitated. Now they're actually using the stem cells from themselves, from their umbilical cord and placenta, and going intranasally. So you bypass the blood-brain barrier and you get them right into central nervous system. And within 10 minutes, they're in there, because the studies, the research shows it's in the cerebral spinal fluid via intranasal procedure. It's a flexible catheter, no needle there. People don't like to hear needle and head or nose. So we put them right in, and just getting phenomenal results for patients. I've got folks with the Parkinson's diagnosis, their speech gets better. One gentleman he said, his coworkers, their jaws drop. Like, what are you doing? Like, we can understand you, because sometimes the speech gets a little slurred. Again, I'm not going to claim cure on what we're doing, but definitely improvement of quality of life, slowing or stopping of symptoms.
Right. Well, I mean, because what they say, life is a sexually transmitted fatal disease, right? So,
Right.
so there
Yes.
isn't a cure for anything. It's like, how do you have that quality of life to the optimum that you possibly can while
Right.
holding whatever, whatever processes that are destroying us at bay. That's why I
Yeah,
call it the
right.
Bad Girl's Guide to Living Well, right? So that you can have a little bit of fun, live on the planet, not freak out about heavy metals killing us, pesticides
Yes.
killing us, cheeseburgers killing us, and just be able to make the body stronger and healthier so you can have fun and yet
Love
not destroy the process of your health.
Perfect. I love that. I was wondering why you called it the Bad Girls Guide. Yeah,
Well,
that's
because
great.
I like to have a little bit of wine, and I like to stay up late and party, and
That's very sustainable.
it's
Yeah.
and it's not, once I hit a certain age, and I'm like, I am not recuperating as well as I used to. Plus, I'm a Generation X, right? And some of the
Yeah.
sickest people that I see in practice are younger than me.
Yeah.
And so like that piece of like, why are we having 20-year-old women be infertile? Right?
Yeah.
Like, how is this, this youth that's supposed to insulate us? How do we protect that next generation? Because if you're looking back 7 generations, or I think I read somewhere 19, you can see stress genetically 19 generations back.
Yeah.
Right?
Yeah.
I mean, that's a long ass time ago. And so
That is.
so if you can do stuff, preventatively while insulating from all of the craziness, that was the process. So
Love
a
it.
question I have is like with Parkinson's and with neurodegeneration, we always hit this end game, right? Of Cinnamate, carbidopa, levodopa,
Yeah.
and,
That's
good
it.
luck. It'll probably last you 3 to 5 years, maybe. And
Yeah.
right. So is there a way, besides, because there's some genetic stuff that you can look at, I believe, but is there a way to make more of a prediction so that there's a longer period of time in order to do prevention?
That is the $1 million question. So, if we had, that's what I'm going after. That's, after just being in the research really in depth for this last year. So, right. So here coming back to, I said I was going to come back to this on the prions, the testing, I think, so what if it is a prionic disease? Like, what if this is really, that's the case, and there's no known cure for that as of yet. Now, there are 2 substances, possibly 3. Actually, there are 3. So DMSO, which I'm lecturing on at the end of this month to a group of physicians, has been shown to move the prions out of the central nervous system. So DMSO is one of those. The second one is HOCl, which is anhydrous chloride, a fascinating, cheap substance. I discovered this, a patient brought it to my attention. They have about $2 million of NIH research that shows that HOCl, anhydrous chloride, which is what our own immune system secretes around viruses and bacteria to kill them, deactivates prions. And they're using this substance really in on surgical equipment and in crematoriums of all places. But you can buy this stuff on Amazon. It's like it smells like pool water. I had my kids, tasting it, and we were giving it to Sarai as well. I was taking it. I actually carry it in my clinic. I created a DMSO HOCl nasal spray because, if I'm testing here for prions and I want to get it into the brain, this is the best route for that. So I put 2 of the known substances together in a nasal spray, which is also great as an aside for killing biofilms, chronic sinusitis, and any prevention of the early onset of any viral cold.
So can people get that from you for prevention?
They can. They definitely can. Yeah. So they could contact me at the website or send an email to info@naturecuresclinic.com. Currently working on the storefront. We'll have that up on hopefully by the end of the year here.
Because if you think about it, with all of the antibiotic use and our immune system's not working, biofilms, I mean, I hear from one of our mutual friends that films have had millions of dollars dumped into them, research, military, research.
Well, so this HOCl, similar, you look at it's called Briotech, their board of directors is the who's who of infectious disease. in the world. And Dan Terry, the owner of the company, he was he sold the original tech of the Pentium processor to Intel. And his goal is to disrupt healthcare, right? So the guy, he's got kind of a good armament and a great mission. I can really get behind that.
Oh, yeah.
You know, topically, you can spray this on infections. It'll clear MRSA in 5 days topically, right? So incredible uses, very versatile, 125 years of research. Now, the third substance is NAD, which is kind of the flavor of the month, right? I know. Yeah, I see the frowny face, and we've been using it for a long time in the naturopathic community. Now, you know, the integrative community has caught on to the hot topic of NAD.
Oh, right up there with vitamin D and probiotics. Welcome to the party, guys.
Yeah, I know, really. Lovely. Yeah, so innovative. So on that front is, but there is a Scripps research, and bless her heart, she's been at it for 10 years, and she's really focused on prions with the use of NAD. So I'm kind of in early discussions with her to see what she's finding there.
And just so that people know, I mean, you've given 3 things that can, you know, disrupt them.
Right.
They are basically, from my limited understanding, the hardest thing to kill that we have ever found.
They're indestructible, right? You can't freeze them, you can't burn them. You know, you can
automatically degrade them.
Back. Yeah, no. So that's the thing, you know, kind of even on that heavy metal discussion of like, don't get freaked out about this. These are, you know, because I know, really easy for me to say, right? But it is, they're everywhere. So when you realize they're ubiquitous, when you actually read about them, they're always kind of dubbed infectious prions, which even makes it sound more sinister. Nobody knows what turns them on, though. And, you know, this is the same thing in mad cow disease for cattle, right? So in 85, there were 3 million pounds of tainted prionic mad cow beef released in Europe. That was 1985. We saw no uptick of this condition in Europe. So that's kind of interesting. So that kind of proposes possibly the genetic predisposition and I think a trauma level that tends to activate them. So you got to have, I think, those 2 components together for it to be an issue. But what they do, they just congest in the central nervous system. That's where you get the breakdown of all of the functions of the body. So they are ubiquitous. I feel like they're an archaic protein structure because there is no genetic material in there, which makes them very weird. You know, that's the technical term.
No, they really are weird.
Yeah. Fascinating. And, you know, so looking at that, you know, they have to be ruled in or ruled out.
Yep. So I know that there's a couple of things that can upregulate stem cells in the human body.
Oh, yes.
Right? But
yeah.
I think that, and I've done PRP therapies where we take stem cells and growth factors out of the blood and then inject them along connective tissue in order to regenerate for like sports injuries, you know, aesthetics and that sort of thing.
Yes.
But I think the ones that you're talking about are very different because they're younger. So if you take like a 65-year-old stem cells,
Yeah, and that was the old procedure. So one way around this non-FDA regulation was autologous, was autologous stem cell, which is pull cells from your fat and bone marrow and inject them back into you. Right. But at this point, that's kind of an archaic procedure in my book. Like, why would you do that? Like, you have damaged old stem cells that there aren't many of, versus you can get these fresh new ones. 1 milliliter of your own is 200 cells versus 1.5 to 2 million cells of these new ones. Right. Like, let's just go with the new ones. They're going to really help a ton.
So you have a pretty comprehensive therapy that you've put together. You are a destination as far as people being able to come from all over to get these services. So I'd love it if you talked a little bit more about what someone could expect with that, or that process.
Yeah, so we've got some great arrangements with local hotels for discounts. There's one, really beautiful one across from a park, a block away from the clinic. So people fly right into PDX and come downtown. You can even ride on the Max. get checked in and come up to the clinic. And I call it Camp Nature Cures. We've put together, it's with the stem cell therapy, the intranasal and IV. We do hyperbaric oxygen. So people get, if you're coming in from afar, it's usually, people will come in for a week or two. So depending on the length of stay, we'll do 2 90-minute sessions of hyperbaric oxygen with pulsed electromagnetic frequency and low-level laser therapy, depending on what's specific for them. We'll do some acupuncture as well. I've got a great acupuncturist in the clinic. Acupuncture works on blood flow, also stimulates your own stem cells along those lines. We do nutrition therapy, Chinese herbs, nutraceuticals, brain health smoothies, you name it. We want to just supercharge your body and its own healing ability.
Right. Right.
Yeah.
Because I think that they're just to spell it out, if your body is healthy and has what it needs to process, all of these things that we could make ourselves crazy about and never want to go out of the house again about aren't as big of a deal.
Right. Yeah. So, right. And that's, I'm not a fear-based practitioner at all. And so I love the name, your bad girl is that's sustainable. Maybe do some liver detox after your girls' night out, right? That's what you do. Or, a multivitamin mineral. We've had some, local rock stars coming in after their concerts for those, that is very helpful.
That's good medicine.
Yeah, it really is. Yeah, it's sustainable. So, it really is individualized, the treatment plan. So not everybody gets all of those therapies, but some people do. Depends on, where at on the continuum somebody comes in. We also do a lot with the family constellation work and that kind of past component. Now, one of the pieces, we didn't really get into the energetics of this. So we did talk next time.
We need to do it next time.
You gotta leave a little bit for next time. So that's a big topic.
Yeah. It's a huge topic.
Yeah.
So how about MS or Alzheimer's? Do you see those patients as well?
I do. Yeah. So on that whole neurologic spectrum kind of disorders. So for multiple sclerosis, a little bit more on the immune system. So that's where my, doctoral thesis comes in a little bit more handy there of desensitizing or reprogramming the immune system function as, as possible autoimmune condition for the MS theory. Definitely the heavy metals again in that realm, and the stem cells in particular for helping with gait, walking, muscle strength, along those lines. Yeah.
So I have one more inflammatory question before we go.
I love inflammatory questions.
I have a vendetta against statin drugs.
Okay.
I think that they very well may be the worst thing to happen in medicine in the last 50 years.
Nice. Yeah.
And I've seen research showing that statin drug use significantly increases the likelihood of getting Parkinson's. And there's, have you seen that?
Yes. And, I think they're known mitochondrial toxins, right? So I'm with you. They don't really make a lot of sense at all. It's not on the cholesterol lowering ability. Like half the population is on them, and cardiovascular disease is still the #1 killer. So they're not. It doesn't really work that way. It sells a lot of drugs by lowering cholesterol levels and changing the regulation of what's acceptable. Again, you look at why are we giving the body a known toxin? Right. And I think that's really what's at play there. Yeah. You're looking at, we can manipulate cholesterol, but it really has to improve somebody's life.
Right.
And we're not seeing it. You're not seeing it. I'm not seeing it. The patients aren't seeing it.
No. So how do people find you? Can you give us your web address again? And
yes. So it's naturecuresclinic.com. So it's nature singular, cures with an S, clinic.com, a mouthful. But you can do Nature Cures Portland, Oregon, or Dr. Eckel Portland, Oregon, and we'll come up big right there.
Well, I am so happy to have had you on today, and I do want to talk about that energetic piece, and I would love, awesome. We should do like a round robin with it because it's,
that would be fun.
Part of medicine that's completely ignored, I think. So next week we're actually doing research or dream research.
Oh,
having
cool.
a woman that wrote a book about that. So thank you. This has been the Bad Girls Guide to Living Well. And I'll see you next week, Friday at 2. Thank you, Dr. Eckel, and we'll see you soon.
Thank you.
You've
Take
been
care.
listening to the Bad Girls Guide to Living Well. Join Dr. Heather and her special guests every Friday at 2